yes, of course. Hi, please take a seat. I'm Dr. Lacey. Very nice to meet you. And how can I help you? Okay. Okay. Can I have your full name, please? That's a lovely name. Okay, your date of birth. Okay. Okay, now you can try to describe your problem. Okay. I understand. Well, let's see. Okay, and since when you start to feel like that? Okay, I understand. Don't worry, we'll have a look. Okay. Just a moment. Okay. I want you to look at my nose. Right here. Right here. Okay, try to hold your head straight for me. Okay, look at my nose. Okay, I want you to look at the light now. Try to follow it. Okay, and try to hold your head still. Let's look a little bit closer. Okay. You can blink if you feel like it. Don't worry. You can still tell me how are you feeling. If you remember anything. Okay. I want you to follow with your head together, my fingers. Together with your head. Okay, nice. Together with your head. Okay, together with your head. Together with your head. Okay, together with your head. Let's try to go all the way to the corner, okay? From your right corner all the way to the left. Okay, beautiful. Try to still hold your head still now and do the same thing with the finger. Okay, look at my finger. Okay, finger. Okay, finger. One more time. Okay. I'm very curious about your peripheral vision. Okay, is there something you want to tell me? Okay, so now I want you to please hold your head still. From your right peripheral vision, you will see my finger appears. I want you to let me know. Okay, good. I'm gonna close my right eye, don't mind. It will appear from the right side. Let me know. I want you to focus on my nose and only on my nose. It will appear. Let me know. Beautiful. Okay, I'm going to close my left eye. Don't mind. From your left peripheral vision, you'll see my finger appears. Let me know. Okay. It will appear. Let me know. Okay. It will appear. Let me know. Okay, now I want you to look at my nose. Look up my nose. Finger will appear. Let me know. Okay, appear. Okay, it will appear. Okay. I'm gonna try to distract you as much as I can with my finger. Okay, I want you to look up my nose. Try to look at my nose. Here. Sorry. Look right here. To continue our examination with your face, your facial expressions, with your muscles on your face, okay, and some nerves. Just try to stay relaxed, don't worry, it won't hurt, okay? Can you look at me right into my eyes? Okay, can you look at me right into my eyes? Keep looking at me. Okay, look at me. Okay. Now I'll ask you to do something for me. Can you lift your right arm? Yeah, keep it there. Look at me. Okay. You can lower down your right arm. Raise your left arm. Look at me. Keep looking at me. Okay, great. You can lower your arm down. I want you to look right at the center. Right here. Okay, beautiful. You're doing great. Look at the center of my tool. You see that little mirror there? Keep looking there. Yep. Keep looking there. Okay. We're gonna be a little bit faster. Does it make you uncomfortable? Okay, that's enough. You'll come closer. Go back. Good job. Come closer and go back. Okay, now I will come. We'll bring this thing very close to you, okay? Okay, good. Very close to you. Okay. Very close to you. Okay. I'll give you a smaller hammer this time. Now bring it very close to you. Keep looking at my hammer. Very close. Okay, hold your vision there. Very close. Okay, closer. A little bit more closer. Hold it there. Okay, nice. Tell me if you... First of all, I would like you to close your right eye, please. Close your right eye. Thank you very much. Can you please look at the color right here? Okay, color right here. Color right here. Okay, close your left eye. Close your left eye. Tell me if you can see color right there. Okay, right there. Okay, right there. Now with your both eyes, tell me if you can see color right here. Right here. little pressure at some part, on some parts of your face. If it makes you feel uncomfortable, please let me know, okay? It's not supposed to, actually. Okay. Okay, good. Now I have my fingers right here at your temples, and I'll ask you to open your mouth, open and close it. Okay, I'm gonna bring my fingers right here. I want you to blink a few times for me. Blink, blink, blink. Okay, I'm gonna place my fingers right here at your face. Right there, yep. You see the jaw connects to your bone. Now I want you to clench your jaw. Relax, clench your jaw. Relax, clench your jaw. Relax. Okay, now I want you to open your mouth. Open your mouth. Show me your tongue. Oof, my hair got into my nose. I'm sorry. Show me your tongue. Okay, hide your tongue. Show me one more time. Hide your tongue. Okay, I'd like to check your throat. Open your mouth. Let's see. Can you say ah? Okay, it's a little bit redness right there. Are you feeling? Is your throat have any? Do you feel sore throat or itchiness or coughing? Okay, that's going to be just fine. Yeah. Okay, so what can you tell me about your hearing? Did you notice any problem lately with your hearing? Are you saying, huh, a lot? Huh? What? That could be just a habit, yeah. Nothing to do with hearing. I know, right? Okay, let me see. tell me if you can hear some extra sounds coming from an ear. Okay, that would be great if you can make sure which ear. Okay, yep, exactly. Good job. What about now? Okay. What about now? I'm sorry about my stomach. Okay. Now, let's see if you can hear that. Okay. Right or left? Okay. Yeah. Okay, do you hear the distance changed? I want you to let me know also if you can hear that the distance changed from the last time. Okay. Yeah. Okay, great. Okay. Okay, I'll tap on the top of your ear. Okay, maybe a few times. 3, 4, 2. Would you be able to tell me how many times I did it? Okay. Okay. Well, give me a second until I forgot. Okay. So, what can you tell me about your sense of taste or smell? Did you notice any differences? Don't worry, you can tell me. Okay. Okay, now I'll ask you to take a deep breath for me. Yeah, good. In and out. Okay. Deep breath in and out. Deep breath in and out. In and out. Now breathe normally. Okay. Okay, I have these 2 spoons. They're both different temperature. Okay. I'm gonna show you, don't worry. Do you feel the difference between them? Okay. Do you feel the difference between them here? Okay. What about here? Okay. In the middle of your forehead. Okay. Your left eyebrow. Okay. Cheekbone. Another cheekbone. Okay. I want you to do this too with your lips. Can you feel it? Okay. Let's see if you can get your left ear. Is it warm or cold? Okay. Yeah, right here. Is it warm or cold? Okay. Good job. Okay, I want you to... I forgot the name of this. That's right. Okay, so I want you to look at here. And tell me if you can see the dots. How many? Okay. Let's see if you can see the dots here. How many? Okay, the dots right here. How many? Okay, the dots right here. The dots right here. Okay, and one more right here. That's right. Okay, do you see the card? Yes. I want you to look right at my nose whenever you see this card on your left peripheral vision. I want you to let me know. Look right, we can look at my eyes if you like. Okay. Look it right here at me, please. Whenever you see the green card appear. Okay. Look right here at me, please. Whenever you see green card appears from any corner. Okay. Look right here. Whenever it appears. Okay, great. Okay. I'll ask you to... You know what? I will close your right eye for you. And with your left, can you follow the light? Only with your left, follow the light. Okay. Follow. Come a little bit closer. Okay. I'll close your left eye. With your right, follow the light. Come a little bit closer. Follow the light. Okay. Now with your both eyes. Okay. Okay. I would like to examine your sense of smell. Your sense of smell. Yeah. Okay. 1, do you smell anything from here? Okay. 2. Okay. 3. Okay. 4. Very close. But this one was hard. Yeah. 5. Okay. And last one. Okay. I'd like to look at your eyes a little bit closer, if you don't mind. Okay. Okay, I want you to focus up my nose. Okay, I'll give you a little instructions. I'll ask you to follow my finger. Okay. Follow my finger. Okay, stop right there. Yep, right there. Right here. There. Here. Okay, look. 1 second. Let me find the point. Look at my finger, please. Yep, follow it. Right here. Yep. Keep looking here. right here, there, right here, right there. Okay. Okay, just look straight. Okay, I'd like to examine the sensation around your eyes. Okay, if you don't mind, give me your wrist. I'm going to show you that these things look sharp, but they're actually not. But if you can feel the difference, right? One feels sharper, another one not at all. Okay, but none of them hurts, right? Okay, so would you be able to tell me which one feels a bit more sharper than the other one? Okay, if I do that, what about now? Okay, if I do that, what about now? Okay, I'm going to do that. What about now? Can you say on the top or on the bottom? Okay. Okay. Now I'm just gonna use one, not to make it so complicated. Okay? Go around your face, a little bit of your neck, around your ears. Would you be able to tell? Great. Okay. Around your face, your neck, okay, your ear, around. Would you be able to tell? Okay, I'm gonna go behind you. Okay, and I would like to examine the area around your neck. Right here and right here. Okay, would you be able to tell on the right side? Okay. Is it the same one on the left? Okay. hear something on your left? Yeah? Okay. Tell me whatever you hear on your right, if it's the same what you heard on your left. Okay. What about now? Okay. And what about now? Again. Okay. Yeah. Okay. One more time. Okay, great. Okay, we're going to look at the heart. Look at the heart all the time. Look at the heart. That's how they break. Look at the heart. Look at the heart. Okay. I'm gonna give you my wrist. Now I need to squeeze it until I say stop. Okay. Squeeze it until I say stop. Stop. Okay. With your left, squeeze it until I say stop. Okay. Stop. I need to try to push me. Okay. Okay, I will do the same to you. Try to hold it. Okay, good. I want you to give me a high five right here. Okay, right here. Okay, now only with your right arm. Yep, with your left. Okay, with your right. Down to my face. Thank you. With your right. Left. Left. Okay. Well, what can I say? Don't worry. I'm gonna give you something relaxing, okay? So you don't stress as much. I know it's the time when it's so hard not to. Trust me, I hear you. But it's okay. There's some stuff that can help. Why not to use it? Okay, but at the same time, I want you to take care of yourself, okay? Yep. You're taking care of yourself. I'm taking care of yourself. That combo can do anything, trust me. You're very welcome. You'll be fine. Okay, here we go. I'm going to send it to you. You also have your recipe. You can purchase it anywhere you like. Okay, you're gonna take it 2 times a day after breakfast and after dinner. Once you start to feel better, you can just let go. Yeah. You're very, very welcome. Please take care. Please do not stress as much, okay? I know it's hard not to, but